Chapter 7, Legal and Ethical Issues in Managing the Medical Office. Again, another chapter with several key terms. Just review them. You do not have to be an expert in them. That's the value of having the book. Page 140 starts chapter 7 with the introduction. Next is the standard of care for different healthcare practitioners, because that does make a difference. As the medical office person, at the bottom of page 140, you must check credentials of healthcare professionals, and checking them yearly is critical and probably best practice, but definitely upon hire and ensuring these people have the correct malpractice insurance already provided, and also they ensure they're getting their continuing education hours every year. Depending on what type of provider or practitioner you are, we are all held to that standard to maintain our license, have liability insurance, and do continuing education hours. Page 141, maintaining personnel files for physicians. Medical malpractice is also mentioned on page 141. Then you're going to get into some more information. Respondent superior, that's Latin. A lot of our healthcare terminology and verbiage derived from the Latin language from hundreds and hundreds of years ago. Type of malpractice insurance policies are discussed on page 142. 143, providing malpractice medical malpractice. That's certainly up to a facility if they want to provide it or if they want their practitioners to carry it themselves. It is available to us, nurses, doctors, PAs, physical therapists, respiratory therapists, dental hygienists, everybody can certainly access malpractice insurance. And depending on your role and how much you carry, it can be quite expensive. Page 144, categories of medical malpractice awards, different awards that are given to people, and the cost behind that is, no, the cost is not listed, but the different, you can actually, some very interesting information. You can YouTube or Google malpractice awards not too terribly long ago. Oh, maybe 4 or 5 years ago now. Like a dentist in Colorado was found guilty of malpractice, and the plaintiff, the patient, was awarded like the highest ever malpractice award ever in the history of dentistry. So anyway, that's just side note. Wrongful death statutes are mentioned on page 144, preventing medical malpractice claims. Back in chapter 6, we talked about if it's not documented, then it was not done. So your biggest piece of evidence in any type of malpractice suit is documentation. That medical record is going to be the best thing you have on hand. Witnesses are irrelevant due to human error, due to humans potentially lying, forgetting, altering stories, but that medical record speaks for itself when it comes to malpractice. Defending against the malpractice, medical malpractice is mentioned there, page 145. Statute of limitations, there's always a time limit to medical information or medical malpractice accessibility. There's rules involved with that, so read through that. Assumption of risk is discussed on page 145. 146 is table 7.1, statutes of limitations in each state. Now this is as of when this book was published and copyrighted back in 2019. So this is no guarantee that this is still what it is. In North Carolina, it's listed as 3 years from the date of injury or the date the injury was discovered or should have been discovered. All claims must be filed within 10 years. So there you go. I do think it's different on labor and delivery, or when a baby is born. I feel like that practitioner, that provider that delivers that baby is actually responsible for 18 years. But again, I'm no expert, and you don't have to be an expert to, read through and learn from this chapter and meet the objectives of this course. Page 147, contributory and comparative negligence, immunity from negligent suits. Also listed there, and I love how this book on the right side and the left side on the other page gives you the keywords, the key terminology. The last paragraph on page 147, I'm not even going to try to pronounce those Latin words, but you can read about them and their translation and what they mean. Fraud. Oh, page 148. Fraud is a huge thing. You never want to commit fraud, whether it's on purpose or unintentional. You're still held to a standard if you commit fraud, and fines and jail time and prison time, and read all about fraud. Reportable conditions are listed on page 148. Vaccine injuries, revoking medical license. Oh, yes. So, by the way, vaccines, anytime you give a vaccine or if a vaccine is administered at your office, that lot number on that vaccine must be documented with the vaccine, and that there's multiple reasons. I could go into a whole pharmacology talk about that or discussion about that, but vaccine lot numbers are extremely important to document. And revoking medical license, that's not something that a medical office manager would do, but you may be involved in initiating a report of malpractice that would lead to revoking that person's medical license. Maintaining the physician patient relationship, page 148, terminating the physician patient relationship. Sometimes, in a few occasions, a physician has a right to refuse to treat a patient or fire the patient from the practice, but that is rare. Most of the time, a physician ethically, morally, legally must treat a patient. So you can read about that. Page 150, talk about patient satisfaction. This is important. This has to do with not only keeping up with the standards of care, but reimbursement. If you have Medicaid, Medicare patients, and every one of them and their patient satisfaction, the scores are low and you're not providing quality care, the federal government will not pay that bill. So just keep that in mind. Patient satisfaction is important. We always want someone to have an excellent experience at a healthcare facility. Page 150, ethical dilemmas are discussed there, and ooh, that's so much we could talk about that. 152, treating minors in the medical office. Please review that, and also know that some of that is different at with each state level government governing the decisions related to minors in medical procedures or medical treatment. Receiving and processing subpoenas, so we're talking about more legal stuff there. And then the chapter reviews on page 143. Let me know if you have any questions.